Get started with Medicare. Medicare is health insurance for people 65 or older. You may be eligible to get Medicare earlier if you have a disability. End-stage renal disease ESRD, or ALS, also called Lou Gehrig's disease. Some people get Medicare automatically, others have to actively sign up. It depends if you start getting retirement or disability benefits from Social Security before you turn 65. Established in 1965, Medicare is administered by the Centers for Medicare and Medicaid Services (CMS), a division of the U.S. Department of Health and Human Services. Medicare is divided into several parts. Medicare Part A, also known as hospital insurance. Part A helps cover inpatient care in hospitals, skilled nursing facility care, hospice care, and some home health care services. Medicare Part B, also known as medical insurance. Part B helps cover services from doctors and other healthcare providers, outpatient care, durable medical equipment, and some preventive services, health care to prevent illness like the flu, or detect it at an early stage, when treatment is most likely to work best. You pay nothing for most preventive services if you get the services from a healthcare provider who accepts assignment. Medicare Part C, also known as Medicare Advantage, Part C allows private insurance companies approved by Medicare to provide Medicare benefits. These plans typically include Part A, Part B, and may include additional coverage such as prescription drugs Part D and benefits like dental, vision, and wellness programs. Medicare Part D. This part provides prescription drug coverage. It can be purchased as a standalone plan to supplement original Medicare Part A and Part B, or as part of a Medicare Advantage plan that includes prescription drug coverage. Medicare beneficiaries may have different options depending on their specific healthcare needs and preferences. While Medicare covers a significant portion of healthcare costs, it doesn't cover all expenses, and beneficiaries may still have out-of-pocket costs, such as deductibles, co-payments, and co-insurance. 2 ways to find out if Medicare covers what you need. Talk to your doctor or other healthcare provider about why you need certain services or supplies. Ask if Medicare will cover them. You may need something that's usually covered, but your provider thinks that Medicare won't cover it in your situation. If so, you'll have to read and sign a notice. The notice says that you may have to pay for the item, service, or supply. Find out if Medicare covers your item, service, or supply. Medicare coverage is based on 3 main factors: federal and state laws, national coverage decisions made by Medicare about whether something is covered, local coverage decisions made by companies in each state that process claims for Medicare. These companies decide whether something is medically necessary and should be covered in their area. What isn't covered by Part A and Part B? Medicare doesn't cover everything. If you need services Part A or Part B doesn't cover, you'll have to pay for them yourself unless you have other coverage including Medicaid to cover the costs. You're in a Medicare Advantage plan or Medicare Cost plan that covers these services. Medicare Advantage plans and Medicare Cost plans may cover some extra benefits, like fitness programs and vision, hearing, and dental services. Some of the items and services Medicare doesn't cover include long-term care, also called custodial care, most dental care, eye exams for prescription glasses, dentures, cosmetic surgery, massage therapy, routine physical exams, hearing aids and exams for fitting them, concierge care, also called concierge medicine, retainer-based medicine, boutique medicine, platinum practice, or direct care. Covered items or services you get from an opt-out doctor or other provider except in the case of an emergency or urgent need. Find out if Medicare covers a test, item, or service you need. If you're not lawfully present in the U.S., Medicare won't pay for your Part A and Part B claims, and you can't join a Medicare Advantage plan or a Medicare drug plan.